Can adults experience bedwetting? Have you ever wondered if bedwetting is just a childhood issue? Well, it turns out that adults can experience bedwetting too. This condition is medically referred to as enuresis or nocturnal enuresis. While many people associate bedwetting with children, it can persist into adulthood or even start later in life for those who never had this problem as kids. There are two main types of adult bedwetting. The first is primary enuresis. This occurs when an adult has never had a period of at least 6 months of consistently dry nights. It affects about 1 to 2% of adults and often represents a continuation from childhood. The second type is secondary enuresis. This type begins after a person has had at least 6 months of dry nights and is usually linked to an underlying health condition. So, why does adult bedwetting happen? It often occurs because the person cannot wake up in response to bladder signals during sleep. This is different from nocturia, where a person wakes up to urinate. The inability to wake can lead to involuntary urination during sleep, which can cause embarrassment and disrupt sleep. Several factors can contribute to bedwetting in adults. One common cause is an overactive bladder. This condition involves frequent and sudden urges to urinate, which may lead to leakage during sleep if the person does not wake up. Urinary tract infections can also be a factor. These infections can cause bladder inflammation and frequent urination, increasing the risk of bedwetting. Sleep disorders, such as sleep apnea, can interfere with normal sleep patterns and bladder control. Hormonal imbalances can play a role too. Specifically, a deficiency or insensitivity to antidiuretic hormone can lead to excessive urine production at night. Genetics can also be a factor, as bedwetting tends to run in families. If one or both parents experienced bedwetting, their children may be more likely to face the same issue. Other health issues can contribute as well. Conditions like diabetes, bladder abnormalities, and neurological disorders may increase the risk of bedwetting. Stress can also play a role, as it can affect sleep quality and bladder control. From a sleep wellness perspective, adult bedwetting is important to recognize. It can significantly disrupt sleep quality and overall well-being. The embarrassment and anxiety associated with bedwetting can further impair sleep. Addressing this issue involves identifying and treating underlying causes, improving bladder health, and sometimes using behavioral or medical interventions. Consulting a healthcare provider is recommended for proper diagnosis and management. Adult bedwetting is a recognized condition with multiple potential causes. It is not just a childhood issue that disappears. Effective treatments exist that can improve sleep wellness and quality of life for adults affected by this condition.